Hey, welcome everybody. I got a few minutes with a friend of mine and colleague, a medical malpractice lawyer from New York, John Fisher. And yesterday in the news, I recently saw that the Prince estate has filed a medical malpractice claim in the state of Illinois against some healthcare providers and Walgreen Corporation. And I figured we would discuss this since it's in the news and try to break apart a little bit about medical malpractice. John, tell us a little bit about yourself and what you know about the case.
Well, I'm a medical malpractice lawyer in the state of New York. That's all I do 100%. And I also practice outside the state of New York. So I have active cases right now in Alabama, Iowa, South Carolina, and Pennsylvania. So my primary focus is birth injury, but I handle things like psychiatric malpractice, heart attack, stroke, cases involving catastrophic injury. But it's what I love to do, and I enjoy it. So this case with Prince really kind of resonates with me because it's a very common defense theme in a medical malpractice case that they will try to blame the patient for everything that happened. And the most common defense in medical malpractice, Guy, is that the patient did not comply with the instructions and advice that was given to him or her. And in this case, a lot of times there's no merit and it's a totally bogus, made up, trumped up charge. But in this case, what happened to Prince was he's coming back from a concert and he's on his own private plane and he is suffering from respiratory distress. And basically, he's totally unconscious because he was using opioids. These are very heavy dose pain narcotics that lower your respiratory system. They depress your breathing. They lower your heart rate. They do all of this stuff, and they give you a very powerful drug-induced euphoria. And what he was, they took him, they stopped, did an emergency landing in Moline, Illinois. On the way back, they were trying to get to his home in Minnesota. And when they stopped there, the EMS who met him, Prince was totally out of it. So they gave him a medication called Narcan, which counteracts the effects of an opioid. So it sort of will revive a person who has got respiratory distress, low blood pressure, and is basically lethargic and has altered mental status. They gave one injection, didn't work. Second injection basically pumps some life into Prince. They take him to Trinity Hospital in Moline, Illinois, where Prince is treated. Now, here's the critical thing. When Prince gets there, he declines all medical tests and all of basically the medications that they can give him there at the hospital once he's aware. He had in his possession a medication, the opioid medication for his chronic drug and pain. And they sent that to a Walgreens pharmacy, which is kind of bizarre because most hospitals would have their own independent lab. But if not, they would ship it out somewhere and keep the patient there. But they sent it to Walgreens to test it. Walgreens basically found that it was this opioid intended for a heavy-duty pain narcotic. They sent it back, and at that point, Prince decided that he wanted to leave this hospital. From my understanding of the allegations in the wrongful death lawsuit, it's a very short stay. I mean, I'm just surmising that. But he leaves the hospital. They fly him back on his private jet to his home in Minnesota, and he's out 6 days, and then he dies of a overdose of a narcotic medication that was laced with fentanyl, which is a very heavy dose. It's about 10 times the effect of a standard opioid. So he dies of that. The claim in the wrongful death lawsuit that's been brought by representatives of Prince's estate is that there was medical malpractice committed at the Trinity Hospital in Illinois, but also by Walgreens. The claim against Walgreens is that they should have known that the medication that Prince possessed did not have a legitimate purpose medically for any type of treatment. The claim against the hospital is not that clear to me, but it appears that they're claiming that his overdose was not appropriately treated or managed. Here's the critical point for the case. Prince declined the testing, treatment. He didn't want any blood work, didn't want toxicology screening, and he declined it. The critical issue in a case like this is one involving patient rights. Patients do have the right to decline treatment if they so choose. What's going to decide this case, Guy, I think, is whether the hospital doctors properly documented in the record that Prince declined medical advice that they had given him. And that's called against medical advice. Most hospitals will have a form called against medical advice where they explain what treatment is needed, that the patient's declining the treatment, and what will happen if the patient does not get the treatment. That document is made part of the medical record, it's witnessed, and it's also signed by the patient. This against medical advice document is the ultimate cover your ass medical document, because if I ever have a case where a patient has declined medical advice and they documented that appropriately on the form, then there is no liability. There is no deviation from the standard of care by a nurse or a doctor. And I say goodbye to those cases 100% of the time. So the key issue in this case, Guy, is going to be, did the care providers at this hospital appropriately document that Prince had declined their advice and instructions? If they did, I don't see this case as having any merit at all. The claim against Walgreens Pharmacy, it's not the role of a pharmacy to determine whether a medication is appropriate for a medical condition. Most claims against pharmacies that I've seen, Guy, deal with the pharmacy issuing the wrong type of medication, or they give a dose that was not prescribed. So, for example, if a patient is supposed to get morphine and the pharmacist issues times what was prescribed, well, there's a good for a pharmaceutical error, but that doesn't appear to be the case here. The pharmacy, Walgreens, was used for a very limited purpose of determining what the medication was that Prince had in his possession when he arrived at the hospital. I really don't see any merit to that claim at all.
Okay, you have really talked about a lot of stuff. So let's back up and tease some of this out. The first thing that I think we need to talk about is opiates in general. So opiates are known to suppress respiratory function. So what opiates do, besides, blocking pain receptors, is they block receptors that have to do with our ability to breathe. And so a drug like Narcan, so he was in respiratory distress. And we know that that's where a lot of folks who OD on opioids, with this whole opioid epidemic, it's usually respiratory distress or respiratory suppression. And that's what drugs like naloxone and Narcan do. They go and they stop the opioid from being on that receptor. So it stops the respiratory suppression, and hopefully they're able to breathe better. So we know that happens. The second thing is we're talking about medical malpractice. And so you used a lot of terms of art. So let's break this down. Standard of care. What the heck is standard of care?
Well, standard of care, basically, that means the rule of medicine that applies to a given situation. And sometimes that rule is not very clear, but in many cases it is clear. So, for example, if somebody goes to the emergency room complaining of the sudden onset of chest pain while at rest, that is an alarming sign of unstable angina, meaning there's not enough blood flow going to the heart. The standard of care under those circumstances is to put the patient on a sequence of EKGs and a blood test called a cardiac enzyme, where they're checking the blood to see whether the patient's had a heart attack. So that is the standard of care for that presentation. Now, for example, let's say, Guy, a patient goes to the emergency room and says, I feel like killing myself right now. Well, the standard of care is that if the patient's not willing to voluntarily admit himself to the hospital, that the doctor has a responsibility to involuntarily admit the patient to the hospital. That is the standard of care when there is an imminent risk of harm to the patient, or if the patient expresses homicidal ideation where he wants to go out and kill somebody. So there are well-defined standards of care, but not necessarily in every situation. So, for example, when a patient comes with an overdose, what is the standard of care? Well, the standard of care basically would be to make sure that the patient is, when emergency medicine means we don't want this patient dying in the next 24 to 48 hours. So you don't just say, hey, no problem, good luck, see you later. You'd admit the patient at least temporarily to the emergency room and let them recover. Give them the antidote agent to sort of get their respiratory system going back, get their mental status back, and at a minimum, you'd want the patient to be stable before they're discharged.
So in the emergency situation, they used to call it the ABCs. Now they call it the BCA. You always have to worry about what? Airway, breathing, circulation, right? So what they're doing is they're sort of stabilizing somebody. And so when we're talking about standard of care, we're sort of talking about, what a doctor similarly situated, right? Whether it be in Moline or in Northwest Indiana or in Kingston, New York, would do under the similar circumstances. So you use the example of somebody presenting. The first thing that's going to go in your differential on the thing when somebody is my age, fat and 50 years old, goes into the emergency room with chest pain. First thing you want to do is rule out a heart attack. So you're going to do serial EKGs, you do serial enzymes. Now, if that shows negative, the next thing you're going to want to do is make sure that it's a lung problem, right? So you're going to want to make sure there's no pulmonary embolism or something like that that's causing the shortness of breath. So you might do a spiral CT or a blood test called a D-dimer or something like that. So in this case, it's sort of a little different. Well, let me step back one second. We're talking about news reports. We're not casting any doubt on the merits of the case. We don't know the facts. That's all we're doing is providing information to people. But in this case, you have somebody who's in respiratory distress, and the hospital's duty at that point in time is to stabilize the patient, right?
Right.
To make sure that he's okay. And to some degree, that was done, right?
Well, it appears that way. We have very limited information at this point.
Right.
I can't determine the merit of the claim without getting the record. But if in fact it's correct that Prince declined treatment, he declined testing, and he said, I just want to leave, and that's all documented in a form called Against Medical Advice, in my opinion, that is a rock solid, not just a rock solid defense to a claim like this.
Right. And so, and you brought up medical ethics. And so when we talk about medical ethics, what you've brought up is something called autonomy, that if a patient has the information and is given proper consents and given proper information, like, John, I want you to stay in the hospital. I want to do these tests. And the reason why I want to do these tests, John, is because I'm concerned that you might have A, B, and C going on. But I want you to know you have the right to decline that, and you have the right to leave. I recommend that you go ahead and you stay here so we can make you safe, but you have that right. At that point in time, John, you got the information, and then you go ahead and you sign out or against medical advice, because I'm the doctor in this scenario, and I'm telling you, hey, I want you to stay and I want to do some more testing. You're saying, no, I'm fine, I want to leave. You're allowed to do that, right?
Well, that depends. As I mentioned before, with psychiatric patients who are suicidal or want to hurt or kill someone else, they can be involuntarily admitted. And state by state, there are laws for involuntary admission, not just of psychiatric patients, but also of patients with physical illnesses. So it really varies. What should have happened in this case is the hospital should have gotten their attorney on the phone or brought him in, whatever, and said, hey, here's the situation. Prince, he's got his respiratory status back. It's stable, but he wants to leave. And we feel that it's necessary to treat him further. And what the lawyer is going to tell them is dot every I, cross every T, because if he's leaving here against advice, we need to make sure that it's documented and it's part of his record. Because, Guy, if I got that case, I'd be like, wait a minute, Prince's estate, he declined medical treatment. There's nothing anyone can do to help him if that's the case.
Let me play devil's advocate. Okay? Can I play devil's advocate for a second? Just 1 second? What
Yes.
if the argument from the estate would be something to the fact, look, he was on narcotics. He didn't have the ability to consent one way or another. And therefore, there should have been a mental status exam that was done. And so that consent was improper.
I totally agree with that. The one thing is you can't do an appropriate assessment of a patient when he's either under the influence of drugs or alcohol. That just doesn't make any sense. So ideally, you need to get that patient sobered up, and you need to make sure that you've done a mental status exam where they know the date, they know where they are, they know who the president is, which is not necessarily good, but they know all these things. And it's like, okay, we've had a doctor look at them. The mental status examination is normal. The patient's passing it so that the patient has the mental faculties to make an informed, educated decision. And a lot of times, as you know, patients decline the best advice, but unfortunately, in many of those cases, there's nothing that guys like you and I can do to help them.
So that's the first step in a medical malpractice case, determining the standard of care and determining whether there was a violation of the standard of care. In this case, I sort of feel like, even if the hurdle of standard of care is met, I mean, I think you still have the next thing, causation. Because, right, so why don't you explain what causation is, John, from your perspective?
Well, causation usually means that the deviation from the standard of care by the doctor or the hospital was a substantial factor in causing the death of the decedent. So in this case, was the decision to discharge Prince a substantial factor? And for example, the delay and the failure to give appropriate medical care for his drug overdose, was that a substantial factor in causing his death 6 days later? And as you point out, a pretty decent argument could be made that it did not, because during that 6-day period, he may have been under the care of other doctors, other care providers who are managing the wait a minute, doctor in-house. That doctor caring for him was a causation defense.
So what I hear you saying is, in legal parlance, we call that potentially an intervening cause, right? We have these 6 days where he could have seen a doctor, where he himself or a physician could have given him a different type of medication, something else could have happened. So you have to be able to link, even assuming that the hospital was negligent, and you and I, we don't know, you still have to show that that negligence was the legal or proximate cause, or as you say, a substantial factor in causing the ultimate outcome. And so, and that's what, when I meet with clients regarding medical malpractice cases, sometimes that's a hard concept for folks to grab. And that is, I call it the so what defense. The defendants say, okay, we were negligent, BFD, so what? Our negligence did not cause or substantially contribute to the ultimate outcome. It happens in orthopedic cases all the time. Okay, you needed another surgery. You had a bad knee replacement. Okay, it could have failed anyway. Or it happens in orthopedic cases where you have, a bad surgery, but then you always have the issue of, was it the underlying injury that caused the need for the surgery, or was it the bad surgery that caused the long-term consequences? You ever hear that BFD defense?
Or the never heard of that defense? Before, no. But Guy, here's the thing. For example, with a psychiatric malpractice case, if the patient comes to the hospital emergency room and says, I want to kill myself, and let's say that they say, don't worry about it, here's some sleeping medicine, go home, and then he goes into the parking lot, and this is an actual case, unfortunately, and takes a knife and plunges it into his heart, that is a very clear cause and effect relationship, because he just left the hospital and he killed himself. There was no intervening time period between leaving the hospital and his death. So let's take another scenario that's unfortunately, tragically, another real life situation. Let's say the hospital, the patient goes and says, I'm suicidal. And the hospital says, don't worry about it, we're discharging you right now. And then a period of days pass while he's home, and there's other things that can come up. Like, for example, let's say that his girlfriend says, I'm leaving you, you're crap. Then that could be an intervening emotional stress factor that has contributed in some way to his suicide. So in other words, the defense will say, during the days that he was gone from the hospital, other things that occurred that they're not responsible for that were factors in causing his death. So it wasn't the substandard medical care at the hospital. It was things that occurred after the patient left the hospital. And that is what is known as a causation defense. So the more time that exists between when the patient leaves the hospital and the patient's death, the more difficult it is to prove that the